First of all, thank you very much for inviting me along. My name's Tristan, I'm the lead in Wales for Coeliac UK. So I represent Coeliac UK here in Wales. We are the national charity for people with celiac disease. Many of you will know about celiac disease, I'm sure, but just to reiterate, it is a serious lifelong autoimmune disease and it affects around 1 in 100 people. So it's far more common than people often assume. 1% of the population has the condition. 1 in 100, but 1 in 10 if you have a first degree relative as well. So the chances of you having celiac disease increase. It's one of the reasons that we suggest you be tested if that's the case. Despite the fact we have 1% of the population with celiac disease, we have a real issue over diagnosis. So less than a third, UK-wide it's 30%, here in Wales it's actually 29%. So the lowest figures across the UK. There's a real challenge over diagnosis, and that's a problem for us, because that means there's roughly around 500,000 people across the UK, 22,000 in Wales alone, who potentially are feeling unwell as a result of celiac disease, continuing to eat gluten, feeling unwell, but more importantly actually running the long-term risk of associated conditions, things like osteoporosis, small bowel cancer, even things like neurological conditions. So there's a real challenge there in finding those missing 500,000 people. That's something I'll touch on again in a moment. So if you have celiac disease, what's going on? Well, if you take in gluten as someone with celiac disease, you essentially have an abnormal immune system reaction. It causes damage to the lining of your gut, flattens these villi, and can affect you in a whole host of different ways, which I'll cover in a moment. The treatment is a strict gluten-free diet for life, and as I say, failure to adhere to that diet can lead to you running the risk of some really serious repercussions down the line. I talked about diagnosis and the challenges around that. One of the reasons for that is because the symptoms can be so varied. So some of the common ones you'll, I'm sure, have heard of, things like weight loss and cramping and bloating, but actually they can be really wide-ranging. So it could be weight gain, nausea, diarrhea, but even things like persistent mouth ulcers, hair damage, teeth loss. So it can be hard to sometimes to pinpoint exactly that is celiac disease. So in terms of when it comes to diagnosing, well, there's this two-step process. First is a blood test, followed then by a biopsy. As has already been hinted at, that's a real challenge actually, and one of the reasons that's a real challenge is because you have to have gluten in your system in order for that to be effective. So we continually make this point, because within those misdiagnosed, underdiagnosed, we're fairly confident, a good chunk of people who have either self-diagnosed and gone, I don't want to have to, I've taken gluten out of my diet, and by that point it's very hard to convince someone to put gluten back in their diet and make themselves unwell in order to go through this process. And we do euphemistically talk of a gluten challenge. So we do encourage people to essentially eat as much gluten as you can during this process, so that these blood tests and then the biopsy itself can be effective. So that can be a barrier in itself to diagnosis, as I say. We've already talked about celiac disease and diabetes. I'm really pleased to be able to come and speak to you today, and for all the opportunity to have had to come and present or exhibit at these events as well. There is obviously a crossover. Celiac disease and diabetes, both autoimmune conditions. Type 1, there is a crossover in terms of 4 and 9% of people with type 1 diabetes also having celiac disease. And we do say people with type 1 diabetes should be tested for celiac disease. And indeed, they should be monitored then if they do start to develop any symptoms and be tested again. It's obviously a challenging thing. We've already heard this morning that the last thing you need if you have celiac disease or you have diabetes, type 1 diabetes, is then having an extra one checked onto you, and you've got an even more strict diet, challenging diet to deal with. And it's one that we increasingly are aware of in terms of those multiple conditions people have to challenge. It's already been talked about this morning. That can make it all the more complicated in meeting those challenges. So that's a bit on celiac disease, but who are we? Well, I've talked about us being the national charity for people with celiac disease. We are also the oldest and largest such charity in the world. We've got offices across the UK. I'm based in the Cardiff office. We also have our head office in High Wycombe as well. And we've been working with people that need to live without gluten for more than 50 years now. We've got 80 local voluntary support groups, so these are local volunteers that come together to provide support to each other. It might be something like recommending where the best place to go and get a good gluten-free fish and chips is. Or it might be hosting healthcare professionals come and talk in more detail. But these are really important, they're volunteer run. We're not government funded, so we rely upon the generosity of our members and our supporters to do the work that we do. So what do we do? Well, we provide independent support and advice. We are the national experts on celiac disease and the gluten-free diet more broadly as well. So we have a helpline you can call. Dietitians, at the end of that, they can answer whatever question you might have. We do a food and drink directory. This is referred to by many of our members as the Bible, because it's that important to them, listing those products that are safe to eat. And we also have things like menu guides showing where you can go out to eat, recipes, and increasingly we are seeing lots more people using our mobile phone apps as well, which bring that food and drink directly to you, so you can scan products when you're in shops, for example. And then we have things like our magazine as well, which showcases the work we're doing, but also the latest in research and other things like recipes as well. We campaign as well though. We campaign to try and change the reality on the ground and improve lives of people with celiac disease. And we also fund research as well. We also have these two symbols, some of you might recognise. These are ours. So we have a gluten-free accreditation scheme, and this is a really handy, quick-fire way of being able to see if somewhere is a safe venue that you can trust. So these are accredited independently, 3,500 venues on catering establishments. And this here, out of interest, how many people have seen this? Oh, no, what's this? Okay, that's not bad, not good. It was a risky question to ask there, I'll be honest. But more than 3,000 products have this on. Okay, so this is the gold standard for gluten-free. This is our cross-grain symbol. Again, this is for manufacturing. I talked about campaigns. What do we campaign on? Well, it won't surprise you that we campaign on diagnosis. Our Is It Celiac Disease campaign has been running since 2015. And again, this is about finding that 500,000 people that are undiagnosed. It's not only that we have low diagnosis rates, but linked to that, we also know it takes a long time for someone to get a diagnosis. So on average, it takes someone 13 years to get a diagnosis of celiac disease. That's a lot of time going back and forth to GP potentially going in secondary care and having unnecessary tests, not getting the answer that they need. So for a lot of people, by the time they get diagnosed with celiac disease, it's a relief, because there's lots of other things they've considered it might be. We also work on trying to improve the availability of good quality gluten-free food as well. So the Gluten-Free Evolution, working with caterers to ensure that you can access that good quality food when you go out for a night out with your family or your friends as well. And again, we know for every person with celiac disease that you get as a new customer, on average there's another 7 that come along with that. So they tend to be dictating where those meals are happening. And finally, we do a lot of work on prescribing as well. So some of you might be aware that in England there's been significant changes to what you're able to get on prescription. In Wales you can still get gluten-free staples on prescription here. In England that's been cut back to a ceiling of bread and flour mixes only. And in some places, in fact many places, you can't get anything anymore at all. Fortunately not the situation we're in here in Wales. I'll talk a little bit about that in a moment. We also research, so we are the largest funder of research, celiac research in the UK. More than £3 million worth of grants since 2005. We have a large research fund as well now, really trying to kick on to improve the understanding of celiac disease. Many of the biggest breakthroughs have come from that research, and I think it's really important here within the context of this day to talk about actually what the relevance of celiac disease research beyond celiac disease as well. So it's a really useful keystone condition, and that what we find out about celiac disease can be really helpful to better understand other autoimmune conditions as well. So it can be a really useful value for money investment in terms of research in celiac disease. On that, we do have our annual research conference coming up at the end of next month as well. I'll talk about it in a moment in terms of our healthcare professional membership. This is a great opportunity to bring together the experts in celiac disease from around the world. And it's a meeting of healthcare professionals to share learning but understand the very latest in research on celiac disease and the gluten-free diet as well. So, I've talked about what we do more broadly. It would be remiss of me not to talk briefly about our work in Wales, with my Wales hat on. I'm the lead, as I say, I represent the charity here. We do have a Wales office. We have 3,000 members here, a fantastic network of healthcare professionals. commercial partners and big manufacturers of gluten-free products in the north and the south. And we have a Welsh Assembly cross-party group on celiac disease, chaired by Dr. Lloyd. And this is really a meeting of healthcare professionals, Assembly members, Coeliac UK members to drive policy change in Wales. And a few examples of some of the things we've done, many of these in conjunction with people in this room. Firstly, on prescribing, we've worked very closely with Hull Health Board on a scheme that they're rolling out, looking at an alternative to traditional prescribing. This is essentially a MasterCard's top-up card scheme. The idea is you get the funds that are equivalent to the difference in cost between gluten-containing products, staple products, and gluten-free. So bread, for example, is about 4 to 5 times as expensive. The idea is then that's on that card, you can then go and use that in shops, rather than having to go through the GP to go through that process and then the pharmacy. We've also done a lot of work in terms of supporting children with medical needs. Quite a few familiar faces in the room here that we worked with on that through the network and also Diabetes UK. We currently chair the Care in Schools Alliance, a grouping of about 20 different healthcare professionals and organisations looking to improve the quality of support for children with medical needs in schools. So that's involved inputting into the ALN Act, trying to secure a better legal grounding and support for children with medical needs, but also improving the supporting learners with medical needs guidance as well. And that's an ongoing process. As I can almost see Josh raising his eyebrows as I mention that process. We also then have our own guidance as well that you can access on our website. So school packs showing you what you should be entitled to as someone with celiac disease or a carer of someone with celiac disease in schools. And we've also been working with the Welsh Local Government Association as well, trying to develop some improved guidance for special diets for caterers across Wales as well. Again, it's a group I know Diabetes UK are part of as well. We host the Wales Gluten-Free Food Show each year as well, so please bear that in mind. Dates will be coming out soon, but this is it's the largest gluten-free specific show in the UK. We have about 1,500 attendees, 25 different exhibitors come along to that as well to showcase gluten-free products. But also, we have experts there talking about the latest in research on celiac disease. We have dietetic sessions, a whole host of things, really talking about all things celiac disease and gluten-free. And finally, we're also doing our best to get it out in the media as well. So you'll often see us particularly in Awareness Week, which I'll touch on in a second, with stories on BBC Online, but also in evening news as well, and often on the radio as well, trying to raise those diagnosis stories with everyone. So I touched on Awareness Week, just a date for the diaries, 11th to 17th of May. This is our Awareness Week, and we'll be doing a lot of activity around that, the Senedd, but more broadly as well. Our focus this year is on primary school age children as well, so it fits into a lot of the work we've been doing around schools. We'll be updating our assessment, online assessment. This is part of the diagnosis campaign. Anyone that has a suspicion they might have celiac disease, there is this website you can go to, 10 simple questions. Depending on your answers, we might then advise you print that off, take that to your GP. As a sort of first triaging, signposting, trying encouraging people to go and get tested. And we'll also have the latest research on epidemiology, updating that 30% figure as well, with some specific stuff on children as well. So, the final slide I have here is just to plug our healthcare professional membership. You'll note in big letters there it says it's free, so there's no reason not to sign up, right? This really gives you all the latest on research findings and the gluten-free diet. It gives you access to information on our research conference, so you can come along to that as well. It gives you access to that gluten-free food directory, but also the mobile phone apps I talked about. So if you have a patient you want to go through this process with, you can show them how the app works. You can scan a product, you can show them the menu guide on there as well. But it's also an opportunity for you to network with other healthcare professionals around this as well. So there's a forum, there's also an account area where you can download specific resources, patient-facing resources as well. So you get all of that and it's completely free. If you'd like to do that, you can do it on the website. I've also got a laptop out on the side there as well. You can go and do that at our stand. There's loads of resources out there as well on a range of things. Please help yourself to them. Come and nab me as well, ask any questions you have on that as well. So I think without any further ado, just to say, Diolch yn fawr, thank you very much. Thank you.